mengi tumefanya kuyawezesha mashirika kujisimamia, kujiegemea na kusimama kipekee, kujiinua na kujiendeleza. Tuliyofanya mengi na ni mazuri.
Basically, Blood Life Initiative Kenya, I'm one of the founders. Apparently, it started off on a personal history basis because one of my friends had a problem in accessing blood for one member of his family. Apparently, she died, but not because of the lack of blood. But whilst we were looking out for blood, I saw the challenges that people faced. So me and him, after we managed to source the blood for the donation, actually we donated blood for the patient. But prior to that, we got discussing because we saw the challenges that people are facing in accessing safe blood for transfusion. So that's where the idea was mooted, that we try and come up with an organization that would act as an interlinkage to people needing blood and to be able to access it, and also to try and mobilize Kenyans to come forth and be blood donors. And so in the process, we managed to find quite a number of gaps in the sense that awareness was almost to a nil level. People donate just because it's a relative or a friend. And that's how the organization started way back in 2005. So we are a registered organization under the National Government Organization Board, who gave us the mandates. Once we explained the mandates for what we are registering the organization for, they gave us a go-ahead and a certificate to start operations.
The biggest challenge is the information gap. Community out there, they don't know the importance of giving blood. They only get to know the importance of giving blood when they need it. So the biggest challenge that needs to be tackled is the information, getting the information to the people. Because different people understand blood donation differently. You go to different parts of the communities and you realize one part of the community is very much willing to donate blood. You go to the other one, they don't want. The other challenge is the myths behind blood donation. The myths that goes with blood. Some of the people will tell you, when you get my blood, you're going to sell it, or you're going to do a ritual with it. And this is the information. These are the doubts that needs to be classified. So throughout the whole program, their biggest challenge has been the information gap.
Many of the youths know about blood donation in school. After the school interaction, they go and no one approaches them for blood. Maybe once they join a corporate, but in between, there are youth organizations, there are youth membership societies, there are just sporting clubs that combine youths. So we saw this is a niche area and it was really fertile for purposes of approaching them to become active blood donors, voluntary active blood donors, non-remunerated. That's the policy of the government to recruit members who are voluntary, non-remunerated blood donors who become repeat blood donors. So how do you do that? First, we approached the organizations and the societies and even organizations that deal with youths, especially like the National Organization for Peer Educators. We partnered with them to try and reach out to the youths who are out of school. We saw this was a serious area that if these youth, especially they've been schooled, they are educated, and if you empower them with the issues of blood donation, they are able to carry forth the message. And amongst their peers, this is an area that if it's really groomed properly, and youths are in a situation that they are still, if they are really told that how they can be able to help the society, they really come forth and help out.
I can say we've gone far. In 2010, when the program came into pace, the correction actually, we only managed to correct around 1,450 units. But throughout the years, we've been able to get up to 18,000 units the whole year. The information that we disseminated, we only managed between 2010 to get information out there to around 6,000 people. But so far we've met one-on-one sensitization and education to more than 250 people. That is one-on-one. So that translates to like 1 million people, because definitely one person will go and talk to 2, 3, 4 people. So that's a milestone that we have really had. Then we have gone far by making sure that we have 5 established and learning donor clubs with members more than 100 per every club. One of the clubs is currently standing in Embu. The other one is currently standing in Meru. We have one in Nanyuki, we have one in Nyeri, and we have one in Theka. The beginning one was in Theka. Theka is where we started, and this club have really gone ahead because it has now other subsidiary clubs in Nakuru, it has one in Mombasa, and it has one in Kakamega. So that's the biggest milestone, because these donor clubs, I don't know how they understand what I mean by donor clubs. These are members who have come together with a common mandate of donating blood. So after every 4 or 3 months, they have a session for themselves, they organize themselves, and then they call now the person who is involved in breeding to come and do the breeding. So those are actually now already recruited donors who will never lose. Through their entire life in donation, they'll be there. That's a big milestone that we've gone.
Our partners in finances, that is the funding, is LVCT Health, Batuk, Kenya Airports Authority. First financials have been LVCT Health. They've been our mother to funding. The rest come in one-off. They do like a few months, then they're off. Then they can come next time, but LVCT has been there all through from 2009. The Ungana project has benefited us Blood Life. As a person, I have grown in terms of how we were accounting before LVCT Health came in. They've really built our capacity in terms of how to account to donors, the books to keep. Yeah, it's been amazing working with that LVCT Health. So we do depend on volunteers for our program. What has happened is that we have donor clubs almost in the regions that we are working with. So we train these volunteers, they become our mobilizers. So anytime that we have any program running on the ground, we engage them. And if our staff are not able, because we are limited, we are only able to work with the volunteers to meet our targets in the regions that they are placed.
So we got to go to Kisumu, and then later on we were specifically allocated Mount Kenya region, Meru, Embu, Nyeri, Nanyuki, to be able to really concentrate on that. That is where we are latest. We've been really trying to set our foothold in the Mount Kenya region. Blood is the center nerve of supplying nutrients to the body. Blood in itself, once it's safe, a person is safe. One of the serious areas that we considered as an organization is blood safety. And blood safety revolves around the core functionalities of having a person not contracting HIV, which is the component for AIDS that causes people to have AIDS. Now, the relationship between blood donation and HIV is that once you've contracted HIV, you are disqualified from donating blood to any other person. So all blood that is collected has to be tested against HIV and other diseases, hepatitis B and other. But for HIV is the most prevalent component that is looked after. And hepatitis B, if a person is infected and this blood is discarded, it cannot be transfused to any other beneficiary once it has been found out. Now, one of our core areas of involvement in terms of awareness of blood safety and is to cause the youths to be aware, or the people we approach to be blood donors, to be aware that they need to keep their body safe.
The future for blood, the Blood Life Initiative Kenya, once the core mandate of recruitment and blood donation organization, that's one will stand, but we want to incorporate 2 other programs which are restricted and we're still sourcing for funds. One of the program is road safety. We did road safety in 2012. We partnered with the road guys and we did a program that we're calling 3,000 Shoes Parade. The 3,000 Shoes Parade that we did in Naivasha, that was mainly just to make sure that we sensitize people on the dangers that are happening within our highways. Then we are also incorporating another program that we want to do that is on health-related matters and healthy lifestyles. That will be mainly done with the youths. Because like these 2 new programs that we want to do, that is the road safety, we will require funds. And we also want to do one other program, that is research on blood's status in Kenya. Because we realize for the last 10 years that blood donor has been in place, there has not been increment in blood donation. Actually, it's decrement. So we are asking, the policies are there. What needs to be charged? What needs to be done? So we want to also do a research that we are calling some donors to fund us to do a research and find out why we have not had substantive blood. Every time that we have an accident, we have to call people. Every time we have a calamity concerning blood, we have to do a media. We need to be self-sustainable. Blood, it's only required when it is needed. If I need blood today, I don't need it tomorrow. So it needs to be there by the time it's needed. So we are calling on donors at least to come on board, help us do the research that can come up with the ways of sustaining and making sure these calamities, when they happen, we are ready and our blood banks are full of blood. Don't need to have to go to the media and telling people to come donate blood, donate blood. And you know, blood is something that cannot be stored for long. It only can be stored for a maximum of 35 days. So we need people to be constantly donating blood, and we need to put measures that are effective.
My name is Jane Oirimu. Currently, I'm working with National Blood Transfusion. I'm a regular blood donor. My very first time I donated when I was in high school. The National Blood Transfusion people came to our high school. They told us that blood was important and it was needed in hospitals. I was convinced by the person who talked to us. We really didn't understand much about blood donations then, but we felt there was a need for us who were healthy to give blood. So then at least I weighed the 50 kgs they asked, and I was of age 16 years. And that was the very first time that I donated. It wasn't very painful, and I promised myself that when I get out of high school, I will look out for the donation centers and continue donating.
Tulipoanza miaka 5 sasa kushirikiana na CDC kutekeleza wajibu wa kusaidia kuangamiza HIV kwa nia moja, LVCT ikatule